Hello friends, this is Dr. Kaustav Basu, Senior Consultant, Gynaecology and Robotic Surgery at Narayana Hospital's Howrah. So today I am going to talk about recent updates in management of uterine cancer. And with the increase in incidence of diabetes, lot of other problems, other chronic diseases are also increasing. Okay, so one of these chronic diseases is uterine cancer. So the main reason for uterine cancer, if we see, is obesity. Okay, so with increase in body fat, the increase in production of estrogen is happening. With the increase in production of estrogen hormone in the female body, the lining of the internal lining of the uterus is also getting thickened, which is known as the endometrial lining. Okay, and this endometrial lining is getting a proliferation, and ultimately it is resulting into cancer. So nowadays we also depend on some testing called molecular testing for diagnosing and treatment of endometrial cancer. So what is molecular testing? So till date we were staging, or we were characterizing the endometrial cancer based on the morphological classification. So that is when our pathologist doctor, he sees the tumor under microscope, he sees some characteristics of the tumor, and based on that he grades the tumor. Grade 1 means it is low grade, and grade 3 it is high grade. What does low grade mean? It is less aggressive. It is a very silent tumor. It does not spread very fast. Even after treatment, the patient generally does not come back with cancer. On the other hand, the grade 3 is a very high grade tumor, or it's a very aggressive tumor. It has a tendency to spread to other organs, lung, liver, brain. And even after treatment like surgery, chemotherapy, radiotherapy, the tumor can come back. So this is grade 3. So till now we were deciding the treatment based on this grading of the cancer. But over the years we had some newer technologies invented, which are immunohistochemistry. So these are like stains which determine the tumor site or the tumor origin, where is the tumor coming from. So immunohistochemistry will guide us whether the tumor is coming from the uterus, or whether it is coming from the cervix, or it is coming from any other organ. And recently we are also depending on some, as I told you, molecular tests, some markers, molecular markers, which can be done on the tumor specimen itself, and based on that molecular marker we can qualify the tumor. Okay, so in endometrial cancer, a completely new landmark change in treatment has happened based on these molecular markers. So there is a molecular marker called P53. If the P53 is wild type or does not take any stain, we call this a tumor biology is very good. So these are not aggressive tumors. Or on the other hand, if the P53 molecular marker is a mutant, if there is mutation, then these are aggressive tumors. Okay, so complete change has happened, and based on this P53, whether it is mutant or whether it is wild type, the adjuvant treatment, the surgery, you can tailor the surgery as well. In surgery, what we do, we remove the uterus, we remove the ovaries, we remove the lymph nodes, which are pelvic lymph nodes, paraaortic lymph nodes. So whether we need to remove the pelvic lymph node, whether we need to remove the paraaortic lymph nodes, all depend on this presence of these molecular markers. Another such molecular marker is Pol E. Another marker is called MSI. So these are markers which can be identified in the tumor specimen, and which is known even pre-operatively. Before operation we can know these markers, and based on these markers we can change our management. Even the steps of surgery can be reduced. Even we can avoid therapies like radiation and chemotherapy. So a complete change in management has happened, I think this is the way forward. We have been seeing patients coming in our OPD. They are doing good over last 10 years, 15 years. They are coming to us and they are doing absolutely fine after treatment of endometrial cancer. So endometrial cancer, whether it is a low grade or high grade, with usually in the earlier stages, and they are completely treatable. So and with this additional discovery of and application of these molecular markers, as I just told you, we are we can identify, we can I would say we know our enemy better, so that the treatment, and also definitely if we know our enemy better, we can avoid, or we can in fact kill the enemy in a better way. So the treatment is much better, and the survival is also much better. So this is a very positive news I thought I want to share with all of you. Thank you.